I woke up in the middle of the night and I threw up all over my bathroom. That's TMI. I realized it mid-sentence. This one's drawing blood way faster. Why would you tell me that? Then I passed out. During this time, he had a field training event, so I stuffed my face so much before that appointment. I felt my first glimmer of hope and happiness. Good afternoon. If you're new here, my name is Lizzie. I'm a military spouse stationed in Louisiana, and surprise, I'm 16 weeks pregnant. My past with pregnancy has actually been really heavy. My husband and I have been through 3 chemical pregnancies, so we've never gotten a heartbeat. But because all of my past pregnancies had ended relatively early, I'd never fully experienced the first trimester. So I really wanted to do a quick recap. I've seen a lot of stories where people take pregnancy tests because they were feeling symptoms even before they got their missed period. For me, I had absolutely no symptoms, except I was 3 days late on my period. So I went and took a pregnancy test. Before I could even get the cap back on the pregnancy test, the second line showed up, and I immediately called our hospital on base to confirm the pregnancy. And once the pregnancy was confirmed, they prescribed me prenatals. And I did ask for repeat blood draws because of my past with miscarriages. I wanted to make sure my HCG was increasing, but they said that was something that they couldn't do. But they did accommodate for me a little bit by giving me an earlier ultrasound. Normally they only do ultrasounds between 10 and 12 weeks, but they got me in at 8 weeks. I was so nervous for that appointment, but before we get there, I want to talk all things symptoms. I was feeling all the bad symptoms. I was having horrible nausea and vomiting. My days looked a little bit like this. I would wake up every single morning at 8 a.m. My husband would be coming home from PT, so he'd make me a bagel while I was in the bathroom throwing up. It was absolutely awful, and it happened every single morning. A bagel was the only thing I could keep down after that. I was continuously throwing up throughout the day, and I quickly learned that if I just eat every 1 to 2 hours, I would be able to keep down all of my food, and I would only throw up once a day that time in the morning. The thing was, I was having terrible food aversions. Everything sounded disgusting. I wasn't getting any protein in because I just hated the meat. Eggs were disgusting. Everything that I had eaten prior, couldn't eat anymore. I was surviving off of fruit, vegetables, and carbs. And I absolutely did not cook once. First trimester had nothing to do with eating healthy and everything to do with just surviving because I was going through it. Because of this all-day nausea, I was no longer working out. My steps went from an average of 10,000 per day to an average of like 500. Another symptom that was just increasing the nausea was my heightened sense of smell. I could smell everything, which, mind you, before I got pregnant, I hardly had a sense of smell at all. The way my nose worked was I could only smell super strong scents, and once I smelled that super strong scent, I could only smell it for a couple of seconds, and then I would go nose blind to it. I don't know why that is. I don't know why that's a sense that I just don't have, but now I do. I smelled bread for the first time. I had no idea what that smelled like, and it smelled disgusting. Every single time I opened the fridge, I would gag. Even though I wasn't working out, I was barely getting any steps in, and I was so fatigued that all I was doing all day was sleeping. Somehow I lost 10 pounds, probably from the days where I was throwing up 3 to 4 times per day. Thankfully, I've gained all of that weight back, but for a second there, I felt like skin and bone. There was a point in time where I had light spotting. I'm assuming it was implantation bleeding, but that gave me so much anxiety because in the past, blood was related to losing the pregnancy. But waking up every single morning and throwing up showed me that my body was still pregnant. I was still having pregnancy symptoms, and I think that's why it took me so long to get on medication for the nausea. Even though it was debilitating, it was proving that my pregnancy was still progressing, and it helped ease my anxiety so much. A little while after the spotting had already ended, I got in for my 8-week ultrasound, and I remember just laying there being so nervous. I was scared they weren't going to show me the ultrasound because maybe they couldn't find anything, or they would show me the ultrasound but it would be somebody lifeless. And those were really heavy thoughts that were hitting me while I was staring up at the ceiling. But they brought my husband in, and she showed me our baby, and we watched our baby's heart flutter. I've never seen that before. We've never received a heartbeat before, and I can't even tell you what that meant to me. I started crying. I felt my first glimmer of hope and happiness since seeing that positive pregnancy test. I feel like I felt the emotion you're supposed to feel when you see that positive pregnancy test that I missed out on. My second appointment was around 10 to 11 weeks. I think it was right in the middle of that. It was a group appointment. All of us women and our husbands went into one room, and we sat sat down at a conference table, and on the TV there was a PowerPoint and an OB was presenting to us like classroom style. I was so nervous going into it because it was supposed to be 2 hours long, and I was scared that I might feel sick and throw up. So I stuffed my face so much before that appointment, and I packed snacks in my bag. But when we got there, they had snacks in the middle of the table. They had gum, they had chips, they had peanut butter crackers, like everything that a pregnant woman would ever want. That was absolutely perfect, and I loved that accommodation. It really felt like we were taken care of immediately when we walked in the room, just seeing that on the table. And the lady presenting was so nice, and she was also so raw. She gave us so many tips and tricks. She taught us how to use the portal, which is a website that tells us when our appointments are and gives us the results to our blood tests and things like that. She also emailed us a link to this purple book, she called it, and it basically has Pregnancy 101, all the symptoms, what's normal during pregnancy, what you should go in for during pregnancy, all the different stages, any question you could ever have, you can find the answer in that purple book. And at the end of it, we took a tour of the hospital, showing us where OB is, where labor and delivery is, where we were gonna get our blood drawn, all of those things, which was so helpful because there were some places that I actually didn't know where they were. My second OB appointment was at 12.5 weeks. If you don't know, my husband is in the US Army, and during this time, he had a field training event that lasted 1 whole month. So he was not able to come to my second OB appointment with me, but I went in, she did a quick ultrasound, and I got to hear the baby's heartbeat for the first time, which was so incredible. And she gave me some ultrasound pictures to take home, and he looks so much bigger in those pictures. And my husband was able to have his phone during this field event, so I got to send him those ultrasound pictures as well as bump updates throughout the weeks. While I was at that 12.5 week ultrasound, she told me that I have hypertension. My heart rate is just a little high, which can sometimes result in smaller babies. So they're sending me about an hour away to Alexandria for my anatomy scan. That way they can get more pictures of the baby's heart. They just don't have that technology at the hospital on the base that I'm at. And I really do appreciate how thorough they're being. I will say I've heard a lot of horror stories of some military-based hospitals not being the best for prenatal care, but so far I can confidently say I've been very well taken care of. And the OB asked me if I wanted to get my NIPT test, which I'm so glad she asked me about because I really wanted to do that, but it didn't cross my mind during that appointment. And I said yes, so I went down to the lab and they drew my blood for that, which, mind you, I've had to get my blood drawn countless times here. And every time I go in, my husband always says, she's bad with blood, she might pass out. Every time I roll my eyes because there was a time back in New York where I had passed out while getting my blood drawn. There have been multiple times where I've been at the doctor's and they're just explaining something to me and I pass out because it's something related to inside of the body. And I do not like anything that has to do with the body. I 100% could never be a nurse. Props to all the nurses out there, but that's not for me. But the reason I've always rolled my eyes when he said that is because every time I've gone and gotten blood drawn here, I haven't passed out. So I always feel like they think I'm faking it or something. But they do give me accommodations every time by laying me back, having my husband Mario talk to me and distract me, and sometimes they'll give me sugar and an alcohol pad to sniff if I feel lightheaded. But I was doing so well at all of those blood draws that I didn't think I needed to tell them this time because I really thought that I had gotten over that hurdle. It's been over a year since I passed out from one of those things. Of course I wouldn't now. At first he started with this arm and I was just staring this way so I didn't have to look at the blood. And once he stopped, I was like, oh my gosh, that took like 2 seconds. I did so well, I'm so proud of myself. I look over and he didn't do the amount of vials that he was supposed to. So I was a little bit confused. He says, oh sorry, this arm is drawing blood really slowly. I wanna see if this arm goes faster. Great, so now I have to sit like this, and so I'm facing my blood. And he sticks the thing in and he's like, oh yeah, this one's drawing blood way faster. Why would you tell me that? Why would you tell me that? So then I passed out. Anyways, at that OB appointment, I did let her know that I was struggling with really bad nausea and vomiting. It was at this point where I was more comfortable that my pregnancy was progressing and I was ready to get put on medication. So she prescribed me Zofran to take every 6 hours as needed, and Unisom and vitamin B6 to take at night. I feel like the Unisom is actually not helping my nausea at all, but it is helping helping me sleep, so I still take it regardless. The Zofran is what's really working for me. I will say when I first started my second trimester, I was no longer feeling those food aversions. I was able to eat eggs again and meat again. I could actually go on walks and work out, and paired with the nausea medicine I was having, I felt so much better, which was a scary feeling for me because every other time my symptoms have subsided was for a very, very bad reason. So I got anxious and I stopped taking my nausea medicine just to see. And there you have it. I woke up in the middle of the night and I threw up all over my bathroom. That's TMI. I realized it mid-sentence, but it did happen. I learned from then on, okay, you're still pregnant, calm down, just keep taking your medicine. Now I want to talk about helpful apps. I absolutely love the What to Expect app. Every time I hit a new week, I go on the What to Expect app and I watch all of the videos for the week. It just feels like I'm achieving a milestone. I'm getting a reward with that because I'm learning all about what's happening in this new week of pregnancy, and I'm reading all of the articles that go along with that. But I will say I don't love the images in the What to Expect app, so I use Pregnancy Plus to see how big the baby is. They have this like 3D image type of thing that I love to look at because it looks pretty realistic, but a lot of their videos are behind a paywall, so it's so much better for me to just pair the two apps together. The next app that has been really helpful that I just found out about recently is Babylist. My sister-in-law told me about it when she was pregnant with her baby. This is the app she used for her registry. She said the reason she did that is because you can use all of the different apps. Like for Target, if you do registry only on Target, you can only get things from Target. With Babylist, they have practically everything: Walmart, Target, Amazon. You can pull things from all of those different places and put them onto one registry. And I love the way the registry breaks up different categories. And they also have a checklist. So if you're new, obviously I'm a first-time mom, I have no idea what I'm gonna need for a baby. They have a checklist of all of the things that you could ever want and need. And lastly, I just wanted to talk about how I told my family and the things that we've already gotten baby. After that 12-week ultrasound, I cut off the top picture and I wrote a letter and I mailed it to my dad. After my dad received that letter, I told the rest of my family over the phone because we are long distance from all of our family. All of our family is in New York. We're here in Louisiana. And the first gift we received for our baby was from my dad. He got baby this little teddy bear and this white blanket. They are so adorable. I just can't wait to see that blanket on our baby. And just yesterday, we got our baby's first outfits. We went to the PX on base and we saw a 5-pack of newborn onesies for $17. And I was so excited because a lot of the onesies were $17 for only one. So I was like, okay, we need to get these. I also heard that there's a pop-up on base at some point for new families and pregnant women, and I'm hoping that I can get there and just see what they have, and I might vlog that. Please make sure you like and subscribe so you can see the rest of the content coming. And I do post on YouTube Shorts. Every single video that goes up on my TikTok also goes up on my YouTube Shorts, so you won't miss anything. And I'll have so many more updates on the second trimester coming soon. Thank you so much for watching, and I'll see you next week for our next long form YouTube video. I'm so excited to start doing these because if you can't tell, I could yap for literally ever. If you look back on my channel, this will be the only long form video. So we're starting this new chapter on YouTube with a really big milestone in my life. Okay, I need to end this. Bye.